he worked for Hospital de Luz. I suppose luz means luce, lights.
Light.
So we are in the path of the patient journey, the patient journey. We start with the diagnosis, talk about the psychological impact of the prognosis when we change the progression. Now we talk about the quality of life, how we manage my anxiety, and how we possible to implement to increase our quality of life. Thank you, Professor Almeida. He is very kind and friendly with the patient organization.
And with the patients as well, I hope. Thank you very much. Thank you, Felice. And I must say it's really a great honor to be invited. I thank Yara for reaching out to me, but it's so nice to come here and see so many faces that I now know, that I've come to know through the years, both in patient advocates, patients, and it's really a privilege for us as doctors because, as you know, and as is mentioned in the first talk, we live in our little world, in our bubble, and I think the more we bridge across from doctors to patients, the more we communicate and we work together, I think the better we can all learn from each other and help defeat our diseases and live with them better. So in order to talk about anxiety, I really thought it would be more useful to look at a patient that I had in my clinic and see how he dealt with his day-to-day life. And I know very often we look at very dramatic situations, but in myeloproliferative disorders, most of the situations are not this sort of life and death, leukemia, relapse drama. They are even more difficult to deal with because they are day-to-day life. Life carries on as normal and you have this huge weight on top of you. And I think this is really a difficulty that most of our patients face. It's not that, it's not that they have a huge life and death moment there, but they have a very heavy diagnosis they have to deal with. This was a young man, he still is. He was 37 when he presented. He's an engineer, and you all know what engineers are like, don't you? They're very precise, they come with their Excel sheets, and in a way I've come to learn that they expect life to work like their machines work. And they expect the numbers to be right, and any deviation is something wrong. And then that is the way they were brought up, in the same way as doctors are brought up to be slightly different. So, it is very important for us as doctors, but also for patients, to understand how the expectations really color the way that we look at our diagnosis. He was engaged to be married, and on a routine blood test, on a work environment, he was diagnosed with essential thrombocythemia. His platelet count was 950, so not excessively high. He was JAK2 positive, he was a smoker, and at this stage, a lot of questions come up. And, there was questions really about the anxiety around all of this. And I think when we're dealing with a patient like this, which I'm sure is a scenario that's familiar for many of us, young, a lot to live for, a lot of life, and by young I don't necessarily mean young in years, but at all stages in our lives we have a lot to live for, whether it be married children, whether it be grandchildren, whether it be someone to care for. And what causes anxiety here? What did he feel was really the main difficulty? Well, I think probably the main one was what's going to happen. All these unknowns. How is this going to affect me? This was diagnosed on a routine blood test, but this is very typical of myeloproliferative disorders, especially polycythemia or essential thrombocythemia. How do I deal with this? What information do I get? And by this, I don't mean what the doctor tells me, but is mostly what very well-informed people have in their day-to-day life. And often, and don't get me wrong, I'm not saying people shouldn't do this, but this is the normal reaction. We go onto Dr. Google or we go onto a book that's on the shelf and we look up the information. And it's not that the information is wrong, but often it does not apply to us. to the patient in particular. And so, and needless to say, internet, journals, what is good is what's sensational. Nobody writes an article about my life has been a breeze with myelofibrosis or with, that doesn't get a hit. What gets a hit is how horrible things have been. All of this really colors the way that everybody who has a diagnosis looks at their disease. And especially for younger people, the lack of control is very difficult. The fact that there is very little they can do in terms of, that's how they feel, managing their counts. They're in the hands of the doctors. The diagnosis is theirs. They didn't do anything. Like Lucia was saying earlier, what did I do? This is a total lack of control of people who are used to taking control of their life. And there are lots of other factors that fall in. There's the stress of your day-to-day life. He's about to get engaged. There are people who are born with a propensity to be anxious, and it runs in families. And then there are other medical problems, such as clinical depression and anxiety, that may color in. And other patients may be taking things that they will suddenly stop. Smokers who give up smoking, that will cause anxiety, or the need to give up smoking and it being difficult. Or people who drink heavily, or even drink moderately, but suddenly feel that they need to cut down because they've had a diagnosis. Not to speak of other substances that people use, and that doesn't make them immune to having other diseases. So all of these are very important. And not only does anxiety give you a bad feeling, but it also gives you symptoms. And I think if you read these, which I won't read them all out, we'll find that many of these symptoms overlap with symptoms that myeloproliferative neoplasms give. So this really brings about a very complex psychosomatic, psychological, and symptomatic feeling. So let's go back to our young man. So what were his main issues? What was he concerned about? He was concerned about how long he was going to have to live. What was his life expectancy with this diagnosis? But then, how this was going to affect his future health. So not so much lifespan, but also, was he going to have limiting illnesses or limiting diseases as a consequence of this thing that was found on a blood test? What impact was this going to have on his work? He traveled a lot. He had a lot of commitments. Was this going to stop him or not? What about his social life? Who did he need to tell? Or did he need to tell anybody? He's here, and me as his doctor, I'm telling him, yes, you have a diagnosis. The most important thing you can do is stop smoking. And there is no evidence that I should be treating you now because your platelet count is not high enough and you have no other high-risk features that make me treat you. So, do I need to tell anybody? What impact does this have? And, we've said this here today. Carrying this on your own is very difficult. And then what life plans? How is this going to happen? Can I have children? I'm engaged to be married. Yes, probably will tell my future wife, but can I have children? Will this affect my children? Will this affect my parents, my siblings? Is this hereditary? All these things are very important. And they require a period of adjustment. And I must say, I very often have the attitude that, that square was brilliant, because patients come in and you can see, you tell them they have a disease, and they say, is it cancer? And you can't lie. You can't say, oh, no, it's just a blood test thing. Yes, it is a neoplasm. And then the head goes into that square. And so it's almost better to say, this is what you have. Today, remember this. Come back next week and we'll talk some more. And the short and sweet is almost better than giving all the information in one go, because they just go away in the middle of a tornado. Wizard of Oz. They have no idea. And when they come back next time, you say, so have you thought about things? And they go, ooh, well. So, I think it is important. this is a message for me as a doctor, but also for patients, to be able to say, okay, doctor, that's fine, thank you. Can I come back next week and talk more about this? Or is there anything urgent that I need to do until next week? Because I need to adjust to this thought now. And there's nothing wrong with saying that. There's no need to have all the information in one go. It's a lot to take in. So what are people worried about in myeloproliferative disorders? Well, they're worried about progression. We've heard about this. I won't go into it, but the concerns they have that patients with Hodgkin's disease or non-Hodgkin's or any disease that relapses are the same concerns that patients with myeloproliferative disorders have. They know that progression is there. It happens. And it doesn't matter if I say it's only 10%. You know, if they're the 10%, it's bad for them. So the statistics don't necessarily console people. They're worried about treatments and the side effects. Fertility is a big issue in young patients, and this has to be addressed. And they're worried about day-to-day life. Now, this very interesting study shows that in all these myeloproliferative neoplasms, obviously more so in myelofibrosis at the top in blue, but also in PV and in ET, quality of life, planned activities that had to be canceled, and call-in sick are all highly prevalent in patients with these diseases. And so this is something that patients need to adapt to. They need to realize, understand, and, like I was saying, accept. And it's not a passive acceptance. It's really to change your life and your expectations of life to know that this can happen. And then you've gone past diagnosis. You start into follow-up. And most patients, especially not with myelofibrosis, with PV and ET, have a relatively normal life with some symptoms, which I'll talk about in a second. And this also brings anxiety. When are things going to happen? And this is what the patient felt. He felt he was sleepless. He was worried about getting married, having children. What if I need to start treatment and I haven't had children yet? Should he be delaying his wedding? Should he be waiting to see how this is going to stabilize? How long do you wait for? Fertility. If I start taking hydroxyurea or interferon, does that affect my fertility? What should I choose? What should I take? How do I get the best advice? And then I feel more tired than normal. I can't be with my friends. The impact on the social life and on life plans is big. So these are really important issues that need to be dealt with. How do we tackle this? How do we tackle all these issues and others? I didn't really want to be exhaustive. Well, you know, I'm a doctor, and we have one knee-jerk reaction with, oh, here, have a pill. You'll be fine. Come back in 2 weeks' time. Thank you. Yes, I mean, that can be a solution. And certainly some patients would like to have medication. And we as doctors need to respect that, and patients need to accept that sometimes medication is the way forward. And sometimes patients prefer to have it from specialists, psychiatrists, go to a psychologist, rather than have it from a hematologist. And that has to be fine as well. So as patients, there should be no inhibition of saying, I'm really not coping. This is day to day. Can I take a pill to sleep? Can I take a pill to be less jittery during the day? And maybe it doesn't need to be forever. But then I think in addition to this, that some patients would like, some patients would not, and I think patients really need to dictate, we need to tackle communication. And communication is not just with doctors and nurses. With doctors, it's sometimes difficult. You know, I'm there to look at the number. Why am I going to talk to the doctor about communication? But nurses are there, and very often patients say things to nurses they will not say to us. And it is very important that nurses are there and available. And then there are other healthcare professionals, which are not always there immediately, such as psychologists, which are very useful and really should be brought in. And so it is important that not only the doctor, but also the patients initiate this search for other healthcare professionals. And then it's very important to speak to other patients, not because we need to share experiences, because they are the people who understand us. They are the people who understand what you're going through when you have a diagnosis, what you're going through when you're afraid of progression. And this is what our patient did. He started to address his symptoms and his feelings, this is not easy for an engineer. A male Portuguese engineer does not talk about feelings. This is no-no. But, he got in touch with his inner self. He started to speak more with other healthcare professionals. And he has said, no, I'm coming here for the technical part to me. Give me the numbers, do I need treatment or not? Where's the nurse? I need to go and have a little chat. And he started speaking with other patients in the waiting room. And waiting rooms are great places. I've had patients who got married, well, not in the waiting room, but, afterwards. But, through that, patients discovered patient groups, whether they be online, whether they be live. Patient groups are very important sources of support and very useful to abate anxiety, because you now see what happens to other people. People have more experience, and this sharing is important. And then there are other strategies, which are personal strategies. And patients say, yes, let's fight. Patients exercise more, because certainly, you exercise, you get rid of energy, you're able to get rid of some anxiety. And if physically you can do it, it's good. Keeping up daily activities and looking at diet are all important strategies that you can do, patients can do to keep it up. So daily walking routines, making sure you get the exercise. We all get up, patients or not, illness or not. We all get up in the morning and think, I'm not going to run today. I'm not going to go for my walk. I don't want to go to the gym, whatever we do. But forcing ourselves to do it to our limits, don't have to go over it, is good. And then he focused a lot on diet. Now, I know we all want to cure ourselves with diet, and then sadly we have no evidence of what is good or bad. But we all know our bodies, and we all know there are things that are good and not good. So he started having lighter meals, because heavier meals made him more tired. This is personal, but it also works for other people, has been documented. He's reduced his sugar intake, because you get a sugar peak and then you slump, and he's reduced that. He drinks more water, makes him feel better. And he's certainly reduced alcohol and caffeine, which are also, as drugs, anxiety-inducing. Now, anxiety is part of the bigger quality of life. And there are lots and lots of factors that make patients with myeloproliferative neoplasms have poorer quality of life. These are the main symptoms that patients with myeloproliferative neoplasms have. But we all know how, even though the symptoms may not be life-threatening, even though the symptoms may be very slight, we know that we are different from what we used to be. Patients know that, you say, well, but can you still run as much? Yes, but it's different. I am more tired. I feel tingling. My mouth goes numb. I get sweats after eating. I never used to do this. And these are things that are important to deal with. How do we tackle these? Well, in general, I think it's very important to record your symptoms. The impression is always very subjective. Whereas if you write symptoms down, then you get to the clinic and say, no, this is what I had on these days. And it's important for patients and for doctors to see what really is important. We can score symptoms. There are several forms. They're available online. And discuss with the doctor, because not everything is myeloproliferative disorders. And help the doctor think laterally. Just because you have a diagnosis does not mean you cannot have other diseases that are very easy to tackle. Taking medication is essential, but also it's important to be careful with over-the-counter and non-prescribed medication. And look out for associations, postprandial sweating, or get sweating when you eat sugar, or when you eat fat, etc. Specific symptoms also should be tackled. And there are very simple ways to do this. For example, patients who get bleeding, soft toothbrushes, avoiding trauma, avoiding other medication and drugs such as alcohol. Gastrointestinal symptoms are very frequent. And tackling diarrhea doesn't necessarily need to be with pills or constipation. Good hydration, care with the diet, making sure that what we eat is adequate for our bowel habits. Avoiding alcohol, etc., is always very important to keep. I'm not going to read all of these out, but if we read these, There are things that you can do in your day-to-day life without having to resort to doctors and medications. Mucositis, either caused by drugs or by the disease. Again, very disabling. And avoiding certain things that aggravate mucositis can make things easier. Concentration and fatigue are, again, important factors. Exercise is a mainstay. Getting enough sleep, but also being in favorable environments. Pain is an important thing, and above all, just to live with pain. Pain needs to be dealt with, needs to be discussed and treated, because living with pain makes you irritable and reduces quality of life. Looking after your skin properly, it's affected by disease and medication. Discussing sexuality, always very, and above all, asking for help. So I think all in all, lots and lots of strategies that can be done at home. There are lots of resources on the internet that can, but, and I think we've said this, all said this, don't live this on your own. Is really not helpful. Ask for help, whether it's from your doctor, whether it's from patient support groups, psychologists. There is a world out there to help. And just feeling that it has to be you and your doctor and it does not work. We're all in this together. So I'll just leave you with Ruben Mesa, which many of you probably know, showed me this poem, and I thought it was brilliant. Because it really shows not only how debilitating symptoms can be, the attitude can change it into being part of life, but also into giving value to life. And this, if you haven't been there, I suggest you go, and it's nice weather. This covers. And this really represents us. Doctors, patients, nurses, psychologists are these men and women who didn't really know where they were going into. These little ships, which were no more than sort of nutshells, to cross the ocean into lives despite all the hardships. And this is what we need to do, to brave the unknown and reach together to a better life. Thank you very much. Sorry, it took a bit. I'll leave that up so you can.